Does your doctor truly listen to you? Today, we sit down with Dr. Miller and talk through exactly how to advocate for yourself at a medical appointment, but then also what exactly to look for when you're looking for your next medical provider. So what will men notice as part of the low testosterone?
Typical symptoms that men will experience: fatigue, loss of muscle strength, or inability to gain new muscle mass despite good exercise and good diet, loss of libido, some fogginess with cognition, mood changes, weight gain. Those are pretty typical symptoms that men come to the clinic with.
When would you expect these symptoms to start for a man?
That's what's hard with testosterone. In the life of a woman, they have a well-defined event starting with perimenopause where their life changes with the change of their hormones. For men, we don't have a particular time frame or a defined event that we see these symptoms start. They're very gradual. You may not have all of them, and they start at different ages. We have men that come into the clinic with low testosterone that starts in their 50s, and we have some that come into the clinic with low testosterone starting in their 30s. So unfortunately with men have a tendency to blame it on other things. So when you're in your 30s or 40s and you feel tired when you come home from work, a natural response is, well, of course I feel tired. I'm working 50, 60 hours a week.
Right.
Of course I'm tired. I have to go to the kids' games tonight. I have to do those improvements to the house this weekend. Everybody would feel tired.
Right.
Or my libido's low. Well, I've been married 30 years. It's natural for that to happen, to lose the spark. Mm-hmm. Or I'm getting a little paunchy. I'm getting the dad bod. Well, I am a dad. I'm in my 40s. That's going to happen. All my friends, it's happening to them as well. So men tend to accept those things as a normal progression of aging. Mm-hmm. But it doesn't have to be that way. So if you have any constellation of those symptoms, get in and get checked. Now, I'm not saying low testosterone is going to be the diagnosis for every man, nor is testosterone going to be the panacea. But to get in and get evaluated.
Right.
For some men, it may be low thyroid. For some men, it may be sleep apnea. But like in my case, it was a multitude of things. But testosterone was probably the one biggest thing in my life that I needed to correct.
So it sounds like the biggest thing that a man can do the second he feels any of these symptoms, or maybe it's not the second he feels it, maybe it's his wife has been nagging him to improve, or else get tested.
Mm-hmm. Yes. Get
what
tested.
Else?
Yeah, get tested. And go to somebody where you can have that conversation with. Not every physician, clinician is going to feel comfortable talking about testosterone. And I'd be willing to guess that probably 3/4 of primary care providers, when you go in and talk about your concern, won't even check a testosterone level. So you're going to have to advocate for yourself if you want to know your numbers.
So why is it important for a man to seek out a specialist like Limitless Male?
I would say from my experience that a man going to his provider with these symptoms, about 75% of the time, the provider won't even think to check a testosterone level. So the man really has to advocate for his concerns to get that level checked. Now, again, it could be other things that are causing the symptoms or contributing to the symptoms.
And then how easy is it to get checked?
Getting the labs done is easy. But unfortunately, a lot of providers have the same workup for low energy, fatigue for a woman as they do a man. Mm-hmm. But we're built differently. Mm-hmm. So going to a provider that's willing to talk about testosterone and willing to check your testosterone is going to be essential. But more important to that, someone who knows what to do with that low testosterone number.
Right. Now, having been through it yourself and having to have come up to that moment where you make that decision, you're sitting across from a man who doesn't want to believe it, doesn't want to get checked, feels like there's something morally wrong with him, or doesn't want to admit this failing, what do you tell him?
Right. Well, a lot of times you'll hear men don't go to the doctor because they're stubborn. And that's true in the case of, let's say, colon cancer screening. It's going to take a nagging spouse often to get that man to go in and get that looked at. But I think for men, what keeps men from going in and getting looked at to have that conversation is denial. Men don't want to admit to themselves that low testosterone is even a possibility. Now, in the back of their mind, they know that low testosterone might not just be a possibility, maybe a probability.
Right.
But they don't want to admit to themselves that that could be the issue. And I see it time and time again. If they don't get diagnosed, they don't have the problem.
Right.
So they really don't want to know. And that was my case, is I had to admit to myself that it may be a problem.
Do you think they encounter the same thing with diabetes? I'm wondering if it's they don't understand that low testosterone is something that is almost inevitable.
And that is a great thing to compare to, because they're both endocrine problems. They're both hormone problems. A man would have no problem going in and saying, I'm worried about my blood sugar.
Right.
Because there's no judgment.
Right.
There's no bias with that. But for a man to go to his provider with that concern of low testosterone, for many men, it's akin to admitting, I feel less than a man. Because we think of testosterone as virility,
right,
as the definition of manhood. So when your testosterone is low, is your manhood low? So unfortunately, that's how a lot of men feel. And even though I was a physician who treated low testosterone, when that thought came to me as potentially my problem, I had that same thought. I had to tell myself, you're a physician, you know better than this. Now, I would never have that same prejudgment of any man that came to me with a testosterone question. So why am I being so hard on myself?
Right.
So if I'm that hard on myself, I know that's got to be true for many other men.
So what can we do as a society, as a wife, as a doctor? What can we do to help remove that fear or that stigma from low T?
One thing that I've seen that's very encouraging is in the new media market, podcasts like this, YouTube, some of the various venues where you can follow these videos of particular interest. You see an explosion in videos focused on men's health and performance. It's normalizing the conversation. Mm-hmm. If we can have the conversation with each other without fear of judgment, it's going to make it easier for that man to go to his provider and confidently ask about that as a potential diagnosis.
Right. The more they're informed,
right,
the less scary it is.
And what you're going to find is, unfortunately, a lot of men will go into that conversation with their provider, if they've done enough of the background search, with a stronger fund of knowledge about the topic than many providers will have.
Interesting. So that's why it's key to know exactly what to look for and what questions to ask.
Correct.
There's a whole undercurrent that is very angry about tirzepatide.
And actually on a Joe Rogan podcast, I think this is his most recent one, he's talked to a compounding pharmacist about it. They had this conversation.
Interesting.
And some of the anger that people have against it. And Joe had always been of the belief that it's a self-discipline issue. Eat right, exercise. You don't need the medicine. He admitted that. But then I forget who made the point, and he came around to the belief that it's somebody chalking up a win in their column, an early win. Because if you can get somebody to see early success, that's going to get that person more involved in their diet. That's going to get that person at the gym more. That's going to give them that jump start they need to make those lifestyle changes. So for me, that's exactly how I use semaglutide. I never exercised before. I wasn't eating right, but I was presented with the opportunity at Limitless Male Medical Clinic to start semaglutide. And I thought, well, I need to get my money's worth. I'm going to do what I need to do on diet. I'm a physician. I know what I need to eat. I need to get moving. So I got started. You don't have to have the perfect workout regimen. You just have to get moving. You have to start somewhere. as a side note, in my case, I spent days researching, trying to find the best workout regimen for a man of my age with my goals. And I was drowning with knowledge. I could not find something that was perfect for me. I found 1,000 things, and I had a hard time discerning what would be the best. And I told myself, it doesn't matter. Just start moving. So I grabbed a kettlebell and just went with it. And from that's how I was able to springboard into comprehensive lifestyle change.
Which is important on something like semaglutide, because once you're off the medication,
right?
If you haven't made those changes, if you haven't done the right steps and incorporated exercise and changed your diet, yes, you are going to gain the weight back.
Right.
That's fundamentally what happens.
It gives you an opportunity to develop a new relationship with food, to develop a fitness program that will carry you through and help maintain that success. And once you're able to achieve the body, the physique, the goals you set out to, you'll do everything you can to maintain that.
Whether that's on the medication for life as well.
Right.
I know that a lot of us, myself included, I've stayed on the medication because it also helps prevent migraines for me. So it's something that may have other anti-inflammation benefits, et cetera, but...
Right. And you'll find that a lot of experts in the obesity medicine sphere have come around to the idea that your GLP-1s have a strong role for maintenance therapy, realizing that obesity is a chronic, relapsing, multifactorial condition, meaning there's many things that cause obesity. Chronic and relapsing are the most important words in that.
Interesting.
You don't just think of treating somebody's diabetes, getting it fixed and walking away from them.
Nope.
You don't put somebody on blood pressure medicine for 6 months and then leave them on their own.
Nope.
We know obesity for many Americans will come right back from the genetic issues, epigenetic issues, cultural, diet, exercise, whatever the limitations, whatever the complications are. Obesity often creeps right back into their lives.
Not to mention that, but obesity is the cause for unnamed number of morbid,
right.
diseases.
It's the underlying factor that ties it all together.
All of it.
In primary care, I would often make the comment to my nurse that if we could eliminate obesity and smoking, I would be like the Maytag repairman. If you remember that commercial, you'd sit around with nothing to do.
Yes.
Because virtually everything I saw in my typical clinic day as a primary care clinician were as a direct consequence of obesity or smoking.
I mean, it's amazing. And that's why the GLP-1 medications are so society changing.
Right. Public health measures over the last 20, 30 years have done nothing to help. If anything, they've made things worse.
You remember the low-fat diets?
Yeah, by confusing people what to eat, the food pyramid.
Yes.
If you want to fatten up livestock,
let's go ahead and put
you follow the food pyramid.
Carbs at the bottom.
If you want to make the large multinational corporations involved in food production richer, follow the food pyramid.
Absolutely. And it still hasn't been redone.
Right.
Because even the redone version is still not something that's healthy with the amount of dairy and the amount of carbs that are on there.
And you could be somebody who wants to be healthy. You got to realize the deck is stacked against you.
Yeah. I think the most surprising things about the GLP-1s is the kids. The studies that they've done with children that are unable, they have their entire diet regimented.
Right.
And they still aren't able to lose weight. But because of this medication, they're able to actually lose weight when they weren't able to before. Same with PCOS, women with PCOS that aren't able to lose weight. I know that there's it's amazing. We can go down a rabbit hole, but the research that they've done, fertility and addiction and the Alzheimer's and dementia studies that they're doing now. It's pretty astounding. So, but quit smoking, lose weight.
Men would have no problem talking about having low thyroid.
No. Yeah.
There's no stigma. Testosterone is just another hormone.
I'd be curious if we follow the same route as mental health, because I feel like mental health has had a resurgence since COVID. It really came to the forefront. And now people are actually okay talking about depression or anxiety or ADD, for example. But that was taboo forever. That was absolutely something that you didn't want to get diagnosed with, because that made you feel like less of a man or less of a person. I remember, and now it's chemical, literally brain chemicals is what's happening. And some people's brains are wired differently than others. And we just have to manage that with chemicals and therapy, etc. But yeah, if we could just find that way to change the conversation about low T, because it isn't your George from Seinfeld. That's not what low T is. It's your 30-year-old, your early 40s that just...
Yeah, everybody, when you think of... I had this revelation on the way here. Historically, when you think about who is on testosterone, it was that little guy that wanted to chase around his wife in his 80s, or the bodybuilder abusing it.
Right.
You never had, Joe Suburb,
right,
the accountant.
That just
that wasn't who came to mind.
No, that's fairly in shape.
Right.
That's fairly young. That maybe doesn't have a physical job, but they're tired and they just can't live their life, and foggy. And it's because I think a lot of the symptoms are so nebulous. They're just they feel like mental health symptoms, or they feel like the symptoms of a hard life or a hard job or kids, or it's not. That's the littlest thing. And that was one thing that Corey had said too. And it's interesting with your patient that you were talking about, you saw him and then you saw him 3 months later. So it's almost that you won't see it day after day after day. It's a snapshot between where you were when you first noticed the symptoms to where you are 3 months later.
Right.
And when you sit and you talk to a guy about that, they're like, oh yeah, absolutely.
And that's what
different.
and that's exactly what we do in the mental health world. I treat depression, anxiety in my primary care practice. And we take those snapshots with standardized assessments. When they come in for depression, we do something called a PHQ-9. And 6 weeks later, we have them fill out that same tool, and we get a new score. And we compare those numbers longitudinally, because the improvement is so subtle that often people will come in and they won't realize that it's working.
Right.
Before I started using the PHQ-9, and then concurrent with using it, I'll ask patients to take a mental snapshot on the day I start therapy, because 6 weeks later, I want you to come back and compare you then to what you are now. And a lot of patients, when I talk to them about their depression, when they come back in, well, I don't know if it's working. And I'll remind them what they told me at that first visit. I document it, and I read my note to them. And a lot of them will have that thought, oh, yeah, I remember that guy. Well, I guess it's working, because that change is so subtle. So we see that a lot with testosterone therapy. And I've worked with a lot of our providers to ask that same modeling question with them. Take a snapshot of where you are now that we start testosterone, because 3 months from now, 6 months from now, we're going to readdress that and ask how you're feeling. And a lot of men, that improvement is not overnight. It's gradual. Some things improve pretty quick, but some of the effects of testosterone take weeks or months to set in.
Right.
So when you compare, take those two mental snapshots and compare, that's when you see the change. Where I see it practically is the occasional guy who's been on testosterone for a couple of years. I feel fine. I don't need this. And they go off therapy. He'll be back, because within a month they come back in. Oh God, yeah, I forgot how it was to feel that way.
And don't they drop lower than they were originally?
Can, yeah, because they're not going to have that feedback loop stimulating their own production kick in right away. So when they get a sense of what life was or what life could be without testosterone, that refreshes their memory of why they came in to see us.
Thank you for joining us today. Check out the show notes for more information or to download our free exclusive guide on finding your own men's health provider.